Hello everyone, this is PHTV Channel 4 in Palos Heights. I'm Sue Jankowski and we are here with Medical Update. Today we're talking to Dr. Sara Greenhill, Medical Director of Interventional Pulmonology at Northwestern Medicine Palos Hospital. Dr. Greenhill, thank you so much for being with us today.
Thank you so much for having me.
Well, you know, Northwestern Medicine Palos has recently launched an interventional pulmonology program. And we just noticed on U.S. News and World Report that it was ranked Northwestern Memorial Hospital 13th nationally for pulmonary and lung surgery. So that's pretty great. And in addition to the new clinic, you have a new tool to diagnose cancer in the lungs. The robotic assisted bronchoscopy. So congratulations to you and Northwestern. This is a great thing.
Thank you. Thank you.
So many exciting things are happening here, and we are really honored to be able to bring some of those to our viewers, these great new advances in medicine and the new clinic and technology. So before we do that, I'd really like to know a little bit about you. How did you get started? Why are you here at this place at this time?
Sure.
Just a little background.
Of course. Well, I have been in the Chicagoland area for about the past 14 plus years. I did the majority of my training on the East Coast at the University of Pittsburgh, where I went to medical school and internal medicine residency. And then I did a pulmonary critical care fellowship at Boston Medical Center in Boston, and then came here to Chicago at the Chicago Chest Center, where I did a dedicated year of interventional pulmonology. And I have been working in the Chicago suburbs at Central DuPage Hospital and Edward Hospital primarily for the past 14 years. Recently making the change over to Northwestern at the beginning of July.
Okay, well, welcome. It's really glad
Thank
you're
you.
coming down this way.
Yes,
That's wonderful.
yes, it's been a very welcome opportunity.
Well, that's great. And we're really excited about the new technology, which we'll talk about in a minute. But I wanted to say that November is Lung Cancer Awareness Month, which I did not know. Mm-hmm. And I also did not know that lung cancer is the leading cause of death in, with cancer patients. I didn't know that either.
Yes.
So
yes.
This new technology is going to be, very, very beneficial. So what services does the new clinic offer here?
Right, so our interventional pulmonology clinic and program is really aimed at being able to diagnose and manage any abnormal imaging of the chest. So if a patient gets a CAT scan or a chest x-ray for whatever reason and a spot is found on the lung or fluid is found around the lung, and obviously this can create a lot of worry and concern. Our main goal is to be an access point to be able to get those patients in to be seen in a very timely manner, and then on to whatever procedure may or may not be needed to be able to diagnose and manage these problems, as well as to be able to then take them to the next step and make that referral, whether it be to oncology or to thoracic surgery, and so on.
Okay, so this new clinic will be able to be accessible to people in this area, and then
Correct.
The new technology is something that not all hospitals have, but this hospital does have that available.
Correct.
How does that, is that a tool that would be used in general for many, many patients, or is it very specific to a particular kind of usage?
Yeah, so the robotic bronchoscopy platform is really designed to be able to reach and diagnose lung nodules or lung masses on the lung. So those are really the patients that it is designed to help. It will allow for a higher diagnostic yield, so patients undergoing a biopsy procedure, they are more likely to be able to come out of that procedure with an answer, with a diagnosis. It is minimally invasive, so there's no cutting through the chest wall or anything like that. It can also be used in conjunction with standard bronchoscopy with our ultrasound machines to be able to even biopsy lymph nodes that may be in the middle of the chest to help stage at the same time. So patients can undergo diagnosis and staging all in one setting, one anesthesia procedure, so they're not going from person A to person B or potentially even person C to be able to figure out everything that's going on. And this technology also allows for an increased likelihood that we get an answer for the patients.
Okay, so this would not be necessarily for everyone. It's kind of specific to a certain what you're looking for.
More specific to patients with lung nodules and potential lung cancers.
And then the other techniques of finding, doing a biopsy are still in place.
They are still in place, and they absolutely have a role in certain patients, and even some of these patients with the lung nodules too. It really depends on the patient, on their preference, and really the other findings and potentially other medical comorbidities that the patient may have.
Okay, and my understanding is that you're the doctor who does this procedure here.
Yes.
And there's someone else over at downtown Northwestern,
Yes.
or several
Yes.
people.
Yep. There are two other interventional pulmonologists downtown and another one out in the West region at Central DuPage.
But in general, I'm sensing that this is a really specific skill set that you've got to learn and figure out and practice and so on.
Yes, as I had mentioned in the beginning, I had done an additional year of training for these advanced procedures, and even technology like this, it's best used in patients or by physicians, by pulmonologists or surgeons that really have a good, strong base knowledge and experience in bronchoscopy.
Okay. Now, the robotic assisted bronchoscopy is, you can explain how that's going to change things. I think if we could, we do have some material, some video to look at that I would love for you to kind of narrate for us, because I was able to have a look at it before we got started today, and it's just really fascinating what goes on, and it's so exciting that this is coming to our community where it's close by. I know we could go into the city and do that, but that is a little bit of a trip. This is pretty great.
Yes, and that's one of the goals of Northwestern overall, is to be able to bring the reach of tertiary academic medicine out to the community, really to their outlying hospitals.
Okay, well that sounds great. So we're going to take a look at that right now.
Okay, well here we have an example of the actual system in progress. What you saw was the screens with the arm. Here's the controller. Here is a map of the actual bronchoscopy tree, left lung, right lung, and then the plan out to the green spot is the nodule of interest. The purple line was the edge of the lung. Here is our setup with the arm, the stabilizer arm that will come in and attach to the patient's breathing tube that's in their airways. And so it holds everything in place. The catheter that you see here will be inserted through the breathing tube into the airway. And here's our controllers as we're making our way out to the lung nodule that was in the upper part of the right lung on this patient. And here you can see marking and stabilizing as we're aiming the catheter out to the green spot. And then we're able to insert a needle through the biopsy there, or forceps as well, that will allow us to biopsy the specimen. We're able to place it directly on slides for the pathologist to review right at that same time.
Okay, I think that is so fascinating. I think what's really great for everyone to see is what is a robotic biopsy like, and to understand it, that it's really you're outside of everything and you're manipulating this arm and a catheter and all that. It's
right. It's very different than a traditional bronchoscope where you're right there and kind of guiding everything. This is, you have the piece that's there, that's in the patient's lungs, that's doing the biopsy, but you as the guiding force are a little bit separated, but still in full control of everything that's going on.
I mean, fascinating, and just technology has come like so far to help patients. help doctors do a good job and a better job.
Yeah.
Have you seen like the increase in being able to diagnose people earlier? Is this what is this doing for you as doctors for treatment?
So I think using a technology like the robotic bronchoscopy in conjunction with lung cancer screening that Palos Hospital Northwestern also provides for patients who smoke or who have been recent smokers, to be able to find these lung nodules earlier at a more treatable stage. So one, finding them on the screening CAT scan, and then being able to diagnose and then treat them at that earlier stage, obviously is very beneficial to the patients, in their overall survival and well-being.
Okay, so you see this as just so much forward medicine, making things easier for patients, for doctors, for everybody.
Yes.
Can you see into the future and how this is going to evolve into something even bigger and better?
Oh, well, I wish I had a full crystal ball for that. But I already know that a lot of these companies that have developed these robotic systems are already in development for potential therapeutics. So with the idea of diagnosing right then and then potentially treating even right there. The Northwestern surgeons have even started what's called an A+ program, and they're doing that downtown right now, potentially and hopefully even bringing those services out here where we use the robotic bronchoscopy, diagnose the lesion, and then the surgeons in that same setting will come in and actually resect that portion of the lung, and the patients will even go home that same day.
Wow. That's pretty great.
Yes.
Yeah.
So lots of exciting, fun growth opportunities, not only for the hospitals and the hospital system here, but for the patients in the Palos community, just really to be able to improve their health services and medical services.
Exactly. And I think the whole community is thrilled that this availability is just right around the corner for so many of these suburbs.
Yes.
Right in this area. Anywhere nearby, it's not a big drive.
No.
It's not a big deal to get there.
Hopefully not.
No, not at all.
So.
Well, thank you so much, Dr. Greenhill, for
I appreciate you having me.
No, it's really great to find out, and I think our viewers really appreciate that Northwestern Medicine Palos is really bringing in things that we didn't have before. So this is pretty great. And we want to thank you for watching our medical update today, and hope you enjoyed learning something new. I sure did. And I appreciate the hospital making this all available to us. Thanks for watching us. Stay healthy, stay well. We'll see you next time on Medical Update. Bye. The corner for so many of it's not a big deal to get there.
Hopefully not.
No, not at all.
So.
Well, thank you so much.
I appreciate you having me.
No, it's really great to find. Really appreciate that.